Good afternoon. My name is Jonna Kyles, and today I'm going to talk to you about Tourette Syndrome. The case study that I chose is case number 8. Carlos is a 9-year-old boy which presented to the psychiatrist for changes in his behavior, attention span, emotions, and a new onset of abnormal movements such as shoulder shrugs, facial grimacing, increased eye blinking, fears, and superstitions. On exam, Carlos appeared well-nourished, fidgety with increased involuntary movements such as eye rolling, blinking, and throat-clearing noises. These symptoms led to the diagnosis of Tourette syndrome with comorbid conditions such as ADHD and OCD. Tourette syndrome is a neuropsychiatric disorder that is characterized by motor or vocal tics, rapid and recurrent movements that last for at least 12 months. These can occur between the ages of 6 and 15 and cause negative effects for the child. This condition can be associated with ADHD, OCD, and other behavioral issues. Children and family members have both reported an impairment in social, educational, mental, and quality of life when faced with these conditions. Research has evaluated various treatment options to help improve the overall health of these individuals. Some treatment options include behavioral therapy, habit reversal training, pharmacotherapy, and psychoeducation. The diagnostic criteria is based on DSM-5. One must have 2 or more motor tics, such as blinking or shoulder shrugs, and at least 1 vocal tic, humming, clearing the throat, or yelling out a word or phrase, although they may not always happen at the same time. Have had tics for at least 1 year. The tics may occur many times a day, usually in bouts, nearly every day or intermittently. Tics begin before the age of 18. Have symptoms that are not due to taking medications or other drugs, or due to having other medical conditions such as seizures, Huntington's disease, or post-viral encephalitis. The research rationales are to evaluate if stress influences the frequency of tics in various environments, to evaluate how young people and their parents view treatment options such as behavioral interventions, pharmacotherapy, and desired outcomes, to evaluate how performance monitoring might provide understanding into regulations of tics, to evaluate which treatment options decrease tics and other symptoms related to this disorder, such as behavioral therapy, compared to psychoeducation or pharmacotherapy, to evaluate the efficacy and safety of aripiprazole for tic suppression, to evaluate the severity of tics and one's quality of life by addressing the feasibility and efficacy of habit reversal training and in educational group therapies. The research findings revealed main effect of environment on the number of tics were not significant. Reduction in tics during a stressful situation decreased compared to the relaxation phase. Suppression of tics was noted when the child was asked to stop. Parents and children both had concerns. Lack of having a strong knowledge base for Tourette's or tic disorders from healthcare professionals. Aripiprazole was the most common medication prescribed. Side effects were the main cause for noncompliance, such as drowsiness, tiredness, self-reported depression, nightmares, weight gain, and a sense of not being oneself. Behavioral services were limited, and 76% of parents wanted these services available to their children. Performance monitoring. There were no significant difference in behavioral performances. Children with Tourette's showed an increase in amplitudes on testing, which showed heightened orienting or attention during stimulus assessment. Treatment options in behavioral therapy, pharmacotherapy, and psychoeducation were evaluated. There were significant difference in reduction in severity in behavioral therapy, and pharmacotherapy, while the psychoeducation showed no significant difference. Premonitory urges were significantly reduced by pharmacotherapy and behavioral therapy. Improvement in quality of life was shown in both the behavioral therapy and the pharmacotherapy groups only. Efficacy and safety of aripiprazole. Statistically significant improvement from baseline in both low dose and high dose versus placebo. Severity of tics and quality of life with habit reversal training and educational group treatments. The outcome showed a significant interaction between the HRT and the EGT, suggesting a larger reduction in motor tics in the HRT group. Quality of life improved from baseline in both groups. The overall research rationale is to understand, assess, educate, diagnose, and develop an optimal treatment plan for individuals faced with Tourette syndrome. This will help individuals learn how to limit or suppress their tic disorder. A Tourette fact. Although tics may appear, disappear, and reappear, Tourette's is a lifelong disorder. There is no cure, and there is much research that still needs to be done. The evidence-based treatment plan. Educate and train healthcare providers on Tourette syndrome, especially with appropriate interventions and desired outcome for patients. Incorporate behavioral and pharmacotherapy as an effective treatment option. Oral aripiprazole is safe and effective. Monitor for additional attention resources to balance behaviors for ADHD, OCD, and other behavioral issues. Habit reversal training and group-based treatments are practical options. When you look at tics and Tourette syndrome, know that it's not an easy disease or a diagnosis, and that there are multifactorial issues that play a big role. So it's important for us as healthcare providers to be astute to the diagnosis and assist the patient and family members to the best of our ability. Thank you.